HB 3130 is a multi-layered ban. It does not simply restrict one type of care or one age group. It creates a total prohibition ecosystem by targeting state funding, state employees, state agencies, public institutions, medical licensing boards, referrals and information sharing, contracts with outside providers. The bill states that no state agency, employee, contractor, or public institution may provide gender-affirming care, allocate or reimburse funds for it, refer someone to it, encourage it, or contract with any entity that performs or promotes it. This is not a healthcare bill. It is a statewide blackout on gender-affirming care. HB 3130 creates new categories of gender transition procedure misconduct across the Allopathic Medical and Surgical Licensure Act, the Physician's Assistant Act, the Nursing Practice Act, and the Osteopathic Medicine Act. This means doctors can lose their license, nurses can lose their license, PAs can lose their license, and osteopathic physicians can lose their license. Not for harming a patient, not for malpractice, but for providing or even referring someone for gender-affirming care. The bill also allows state employees who violate it to be immediately fired and lose public employment benefits. This is designed to create fear. Fear is the enforcement mechanism. Although many anti-trans bills focus on minors, HB 3130 is not limited to youth. Its funding and contracting bans applies to all ages. For transgender adults, this means state-funded clinics cannot provide hormones, public hospitals cannot provide surgeries, state insurance cannot cover gender-affirming care, state employees cannot refer adults to affirming providers, and public universities cannot host clinics or programs that support trans adults. Even if an adult pays out of pocket, the infrastructure around them collapses. This is a systemic denial of care, not a youth-only restriction. HB 3130 is especially devastating for trans youth because it bans all state-funded gender-affirming care, bans referrals to out-of-state providers, bans encouragement of social transition, bans contracting with any affirming organization, and protects parents who refuse to support their children's transition. The bill explicitly states that a parent's refusal to consent to a child's transition, including social transition, cannot be considered abuse or neglect. This means a child can be forcibly detransitioned at home. A child can be denied mental health support. A child can be denied medical care. DHS cannot intervene, and courts cannot intervene. The state is telling trans youth that you have no rights to be affirmed, even for your safety. HB 3130 makes it illegal for any state employee, including teachers, school counselors, social workers, and healthcare workers, to refer a student to a gender-affirming provider, provide information about gender-affirming care, encourage a student to explore their identity, or connect a family with affirming resources. Violating the bill means immediate termination, loss of benefits, and potential civil liability. This forces educators and counselors to choose between their job or the safety of a transgender child. It is the law designed to silence the adults who protect LGBTQ+ youth. HB 3130 rewrites medical ethics by inserting political ideology into diagnosis, treatment, referrals, professional standards, and licensure. Providers are punished for following evidence-based care. Providers are rewarded for refusing care. This is the opposite of medical ethics. It is the opposite of patient-centered care, and it is the opposite of science. Gender-affirming care is not cosmetic, it is not experimental, and it is not optional. It is suicide prevention care, mental health care, trauma reduction care, life-saving care. HB 3130 cuts off hormones, puberty blockers, surgeries, mental health support, referrals, crisis intervention, affirming care in public hospitals, and affirming care in state-funded clinics. This increases depression, anxiety, self-harm, suicide attempts, homelessness, family conflict, medical complications, and this bill does not protect children. It endangers them. LGBTQ plus parents and families face reduced access to affirming providers, fear of seeking care, risk of being reported for supporting their child, and increased conflict with schools and state agencies. The bill positions the state against families who affirm their children. HB 3130 is written to target transgender people, but its ripple effects reach far beyond the LGBTQ plus community. The bill allows the state to override doctors, nurses, mental health professionals, parents, and adult patients when it comes to making their own medical decisions. Once the state can ban one category of care, it can ban others. It increases healthcare shortages. Providers may leave Oklahoma due to fear of lawsuits or fear of losing their license or fear of political interference. This affects all patients, not just trans patients. It undermines parental rights for everyone. The bill claims to protect parental rights, but it actually removes parental authority to consent to gender-affirming care, criminalizes supportive parenting, and gives the state final say over medical decisions. If the state can override one group of parents, it can override others. It increases state liability and costs. Civil lawsuits and enforcement actions increase. Court costs, agency costs, insurance costs, and the taxpayer burden. It sets a precedent for ideology-based medicine. If lawmakers, not doctors, decide what care is allowed, every Oklahoman's medical freedom is at risk. HB 3130 is not a healthcare bill. It is a statewide prohibition system designed to eliminate gender-affirming care, punish those who provide it, and isolate transgender people from every form of support. It harms transgender adults and youth. It harms the LGBTQ families. It harms teachers, counselors, and providers. And it harms every Oklahoman by expanding state power into the most intimate corners of medical life.